So this kind of pain in the hip can be of various reasons. It could be as simple as soft tissue or ligament sort of pain, or it could be deep within the hip joint itself, either because of impingement or because of any damage to the head, what we call as avascular necrosis, or it could be an arthritic hip, or arthritis is where the degeneration of the hip joint. So if this is continuously bothering and continuously persisting and aggravating, then it has to be evaluated. So first we examine and see your range of movement, if the hip is very stiff or if there is any particular movement is restricted, and then we basic test is going to be an X-ray to see if there is any abnormality of the head or the socket of the hip joint, and if that gives us enough information and we work on that. If still we don't understand if the X-ray is normal and if we still having pain, then we need to further investigate and we have to get an MRI scan of the hip, which will give us more idea about the soft tissues around the hip, and also if there is any damage to the head in the early stages. And accordingly, we have to go ahead and treat. So in the initial phases, when this pain is there, the simplest thing is to give it some rest and get some physical therapy, some exercises to stretch and strengthen the hip muscles, some analgesia or some anti-inflammatory medication. That's all might be required. But if it is progressing and not settling, then further evaluation with X-ray, MRI scan, and further management.